We're advising patients not to contact their GP practice. They will be contacted by either the GP, or there are now letters coming out from the NHS directly. It may well be that that particular person is in an area where their vaccination hub hasn't yet started, or started slightly later than others, because they're being released in a phased way. The reason being so that everyone is ready and all the resources and support are available. So they will be contacted, and we are concentrating on the most vulnerable initially, so those particularly over 80 years old to start with, and then we're moving down cohorts. We're also doing care homes and housebound patients, and it has actually escalated and ramped up quite significantly recently since the introduction of the AstraZeneca Oxford vaccine. So we're not just dealing with the Pfizer one, and to date we've vaccinated, I think on the 16th of January, it was 4.31 million patients across the United Kingdom. The way the NHS is working these days is that there's a linkage between different practices in what we call a primary care network. So that's a cohort of GP practices working very closely together to deliver healthcare services. You may have actually seen this not just with the vaccine, with other aspects of medicine. For example, in our area, we have emergency care practitioners that do work for our entire area. As frustrating as it might be, it's very difficult to have a hub set up in every single GP practice. So having it more centralised in an area where we can then vaccinate a large number of patients is the way forward, really. But don't be alarmed. There are several hubs around the country, all in these primary care networks, and all the staff are working tirelessly to make sure that we can deliver as many vaccines as quick as possible. No, it's not the only option. So we will be contacting patients, starting with those most vulnerable. If you have received the letter, it just means that you're eligible for one of those vaccines. So you can, if you wish, go down to that route and contact replying to that letter. It may be slightly further to travel, or you can wait for the local vaccines in the general practice locally in the primary care networks to have your vaccine. We're all working very, very closely together, the whole of the NHS working incredibly hard to try to vaccinate as many people as possible. So that's why you may have been offered a few. And some people are even getting those letters after they've been vaccinated by the GP practice. The key message is we will contact you to have your vaccine in one form or another. And if you did wish to wait for a more local, easier to travel route, that is more than acceptable. We will also then be looking at contacting patients subsequently for the second vaccine, which is now being moved to the 12-week mark. So the housebound are amongst our most vulnerable. So the plan essentially is to make sure that all those vulnerable patients are vaccinated and protected as much as possible from this horrible virus. In terms of what we're doing locally, and several areas are doing things very differently, but essentially the aim is to get all these vaccinated as quick as possible. So we're using particular vaccine in order to do that. In our area, we're going house to house with our emergency care practitioners and our general practitioners as well, and our nurses, who are all working incredibly hard. There are obviously certain areas that have a lot more housebound patients and a lot more vulnerable patients, and there are lots of areas that might have younger ones. So that's why there might be that appearance of a discrepancy in terms of the numbers as to why some have vaccinated more than others at different times. But don't be alarmed, we will get to you as soon as possible. Now that the AstraZeneca vaccine is essentially coming thick and fast, we'll be able to get through as many patients very quickly. Everyone will get a vaccine, and the NHS and particularly the JCVI have come up with a list as to who would be the most vulnerable. And what we mean by that, the most vulnerable to COVID, i.e. those that are, unfortunately, if they were to get it, could have the most severe consequences from the virus. And unfortunately, that can be, as we've seen the numbers recently rise, that can lead to death. So what we're doing is we're running through that list, and healthcare workers who not necessarily working for the NHS, for example, pharmacists, funeral directors, all those that play an incredible part are also on that list to be vaccinated as soon as possible. And what we want to do is, including our porters in the hospitals, everyone, the reception staff, will be offered a vaccine. The key message is that we have to use what we've got, and when we get more coming in, which are coming weekly, then we'll be able to contact more people and get them vaccinated. So the message at the moment from Public Health England, from MHRA and JCVI and the NHS itself is that we'll aim to give the same patients the same vaccines. So if you've had the AstraZeneca currently, then 12 weeks later you'll get the same one. So for all those in the most vulnerable groups, particularly those in care homes, being older adults, for every 20 vaccines that are given, you save one life. For all those over 80, for every 160 vaccines given, you save one life. So the key is to spread that vaccine to as many people as possible to save as many lives as we possibly can.